Question 1. Process analysis reveals a surgical assistant preparing a patient for a minor surgical procedure. The patient is visibly distressed, expressing significant pain and anxiety, and repeatedly stating they can't think straight. The assistant needs to review the procedure, potential risks, and post-operative care instructions to obtain informed consent. What is the most appropriate immediate course of action for the surgical assistant? Option A. Inform the patient that detailed information will be provided after the procedure when they are more comfortable. Option B. Ask the patient's accompanying family member to review the information and provide consent on their behalf. Option C. Attempt to manage the patient's pain and anxiety to a level where they can better comprehend the information, then proceed with a clear explanation of the procedure and obtain consent. Option D. Proceed with a brief overview of the procedure and consent form, assuming the patient will understand once the immediate distress subsides. Correct answer is C. Attempt to manage the patient's pain and anxiety to a level where they can better comprehend the information, then proceed with a clear explanation of the procedure and obtain consent. Explanation. This scenario presents a common challenge in surgical assisting, ensuring effective and ethical patient communication when a patient is experiencing significant anxiety and pain, which can impair their ability to process information. Professional challenge lies in balancing the need to obtain informed consent and provide necessary preoperative information with the patient's immediate distress. Careful judgment is required to determine the most appropriate method of communication that respects patient autonomy and promotes their well-being, while adhering to ABSA standards and relevant U.S. healthcare regulations. The correct approach prioritizes the patient's immediate comfort and comprehension. By first addressing the patient's pain and anxiety, the surgical assistant creates an environment conducive to effective communication. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and the regulatory requirement to ensure patients understand the information provided to them, which is a cornerstone of informed consent. U.S. healthcare regulations, such as those influenced by the Patient Self-Determination Act and HIPAA, emphasize patient rights, including the right to receive information in a manner they can understand. This approach demonstrates respect for the patient's dignity and capacity to make informed decisions once their immediate needs are met. An incorrect approach that proceeds with detailed explanations without first addressing pain and anxiety fails to acknowledge the patient's compromised state. This could lead to a situation where the patient appears to consent but has not truly understood the implications of the procedure, violating the principles of informed consent and potentially leading to legal and ethical repercussions. It disregards the patient's immediate suffering, which is a failure of the duty of care. Another incorrect approach, such as delaying necessary information until after the procedure due to the patient's current state, is also professionally unacceptable. This violates the fundamental right of patients to be informed before a procedure and undermines the informed consent process. It also fails to uphold the principle of autonomy, as the patient is denied the opportunity to make a decision based on complete information. A further incorrect approach, such as having a family member provide consent without the patient's explicit delegation or capacity to do so, is a significant ethical and regulatory breach. While family involvement is often encouraged, consent must ultimately be derived from the patient, unless legally established otherwise, e.g., through a healthcare power of attorney, which is not indicated here. This bypasses the patient's direct involvement and violates their right to self-determination. The professional decision-making process in such situations should involve a tiered approach. 1. Assess the patient's immediate needs. Is there pain, anxiety, or confusion that is hindering communication? 2. Prioritize comfort and safety. Address pain and anxiety to the extent possible within the scope of practice. 3. Adapt communication methods. Use clear, concise language, visual aids if appropriate, and allow ample time for questions. 4. Verify understanding. Ask open-ended questions to confirm comprehension rather than simple yes/no questions. 5. Document communication. Record the details of the conversation, including any challenges encountered and how they were addressed. 6. Escalate if necessary. If the patient's condition or inability to comprehend persists, involve the surgeon or other appropriate healthcare professionals. Question 2. The risk matrix shows a moderate to high probability of significant intraoperative bleeding during the planned procedure due to the patient's anticoagulation therapy. As a surgical assistant, what is the most appropriate immediate action when a brisk bleed from a vessel is encountered, exceeding expected levels? Option A. Continue with the current step of the procedure, assuming the bleeding will spontaneously resolve or can be managed later once the primary surgical objective is met. Option B. Focus solely on suctioning the pooled blood to improve visualization, delaying notification of the surgeon until the bleeding is no longer obscuring the surgical field. Option C. Immediately inform the surgeon of the bleeding, its apparent source, and the estimated rate of loss, while preparing to apply direct pressure or assist with other surgeon-directed hemostatic measures. Option D. Attempt to independently control the bleeding using any available instruments or materials, without immediately alerting the surgeon, to avoid disrupting the surgical flow. The correct answer is C. Immediately inform the surgeon of the bleeding, its apparent source, and the estimated rate of loss, while preparing to apply direct pressure or assist with other surgeon-directed hemostatic measures. Explanation. This scenario presents a common challenge in surgical assistance, managing unexpected intraoperative bleeding while adhering to established protocols and ensuring patient safety. The professional challenge lies in the dynamic nature of surgical bleeding, requiring rapid assessment, decisive action, and effective communication within the surgical team, all while maintaining sterile technique and minimizing patient risk. Careful judgment is paramount to select the most appropriate hemostatic method based on the bleeding source, depth, and patient's physiological status. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based response to significant intraoperative blood loss. This involves immediate communication with the surgeon to assess the situation, followed by the application of appropriate hemostatic techniques that are within the surgical assistant scope of practice and aligned with institutional policies and ABSA guidelines. Utilizing established protocols for blood loss management, such as identifying the source, applying direct pressure, and employing adjuncts like hemostatic agents or electrocautery as directed by the surgeon, ensures a coordinated and effective response. This aligns with the ABSA emphasis on patient safety, competent surgical assistance, and adherence to the surgeon's directives. An incorrect approach involving delaying communication with the surgeon while attempting to independently manage the bleeding is a significant regulatory and ethical failure. This violates the principle of teamwork and the surgical assistant's role as a support to the surgeon. It could lead to delayed or inappropriate interventions, exacerbating blood loss and potentially compromising patient outcomes. Furthermore, it disregards the surgeon's ultimate responsibility for patient care and decision-making. Another incorrect approach, such as continuing with the planned procedure without adequately addressing the bleeding, demonstrates a failure to recognize and respond to a critical patient safety issue. This is a direct violation of ethical obligations to prevent harm and uphold patient well-being. It also likely contravenes institutional policies and ABSA standards regarding intraoperative complications. Finally, an incorrect approach that involves improvising hemostatic techniques without surgeon consultation or established protocols is professionally unacceptable. This introduces an element of unpredictability and potential harm, as the effectiveness and safety of improvised methods are not guaranteed. It undermines the structured and evidence-based approach to surgical care that is fundamental to professional practice and regulatory compliance. The professional reasoning process for similar situations should involve 1. Immediate recognition and assessment of the bleeding. 2. Clear and concise communication with the surgeon. 3. Understanding and adherence to the surgeon's directives. 4. Application of appropriate hemostatic techniques within the scope of practice and institutional guidelines. And 5. Continuous monitoring of the patient's status and the effectiveness of interventions. This systematic approach ensures patient safety and promotes effective teamwork in the operating room. Question 3. Consider a scenario where a surgical assistant is reviewing preoperative imaging and notes the involvement of a specific muscle group in an upcoming orthopedic procedure. The assistant needs to accurately identify the type of muscle tissue and its primary function to anticipate the surgeon's requirements for retraction and potential tissue handling. Based on the typical characteristics of muscles involved in voluntary movement and locomotion, which of the following best describes this muscle tissue and its function? Option A, skeletal muscle responsible for voluntary movement and locomotion. Option B, muscle tissue capable of contraction but without specific functional classification. Option C, smooth muscle responsible for involuntary contractions of internal organs. Option D, Cardiac muscle, responsible for the involuntary pumping of blood. Correct answer is A. Skeletal muscle, responsible for voluntary movement and locomotion. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical need for precise identification and understanding of muscle types and their functions in the context of surgical assistance. A surgical assistant must possess a thorough knowledge of skeletal muscle physiology to anticipate surgical needs, assist in tissue manipulation, and understand the implications of surgical interventions on patient mobility and recovery. Misidentification or misunderstanding of muscle function can lead to suboptimal surgical outcomes, potential iatrogenic injury, and compromise patient safety, all of which are directly regulated by ABSA standards for competent practice. Correct approach analysis. The correct approach involves accurately identifying the muscle as skeletal muscle and understanding its voluntary control and role in locomotion. Skeletal muscles are striated, multinucleated cells that are responsible for voluntary movement. Their function is directly related to the musculoskeletal system's ability to produce force and enable ambulation. This aligns with the core competencies expected of a certified surgical assistant, CSA, as defined by the American Board of Surgical Assistants, ABSA, which emphasizes a comprehensive understanding of human anatomy and physiology relevant to surgical procedures. This knowledge is fundamental for anticipating the surgeon's needs during procedures involving the musculoskeletal system, such as orthopedic surgeries or procedures requiring muscle retraction. Incorrect approaches analysis. One incorrect approach would be to identify the muscle as smooth muscle. Smooth muscle is found in the walls of internal organs and blood vessels and is responsible for involuntary movements like digestion and blood pressure regulation. Confusing skeletal muscle with smooth muscle demonstrates a fundamental lack of anatomical and physiological knowledge, which is a direct violation of the professional standards set by ABSA. Another incorrect approach would be to identify it as cardiac muscle. Cardiac muscle is found only in the heart and is responsible for pumping blood. It is also involuntary. Mistaking skeletal muscle for cardiac muscle indicates a severe deficiency in understanding basic tissue types and their locations and functions, rendering the assistant unqualified to provide safe and effective surgical support. A third incorrect approach would be to focus solely on the muscle's ability to contract without specifying its voluntary nature or its role in gross motor function. While contraction is a characteristic of all muscle types, the voluntary control and role in locomotion are defining features of skeletal muscle, distinguishing it from involuntary muscle types and crucial for surgical context. This incomplete understanding fails to meet the depth of knowledge required by ABSA. Professional reasoning. Professionals in surgical assistance must employ a systematic approach to anatomical and physiological identification. This involves recalling foundational knowledge of tissue types, their microscopic and macroscopic characteristics, and their specific functions within the human body. When faced with a scenario involving muscle tissue, the decision-making process should prioritize differentiating between skeletal, smooth, and cardiac muscle based on location, structure, and control, voluntary vs. involuntary. This differentiation is not merely academic. It has direct implications for surgical planning, execution, and patient care. Professionals should continuously reinforce their knowledge through study and practical application, ensuring that their understanding is precise and directly applicable to the surgical environment, as mandated by ABSA certification requirements. Question 4. The investigation demonstrates a significant decrease in urine output and a concurrent rise in serum creatinine levels in a patient undergoing a prolonged abdominal surgery. The surgical assistant notes a stable blood pressure and adequate central venous pressure. Which of the following represents the most appropriate immediate action for the surgical assistant? Option A. Alert the surgeon to the observed changes in urine output and serum creatinine, and recommend a review of intraoperative fluid management and potential nephrotoxic agents. Option B. Immediately administer a bolus of intravenous fluids to increase urine output. Option C. Document the findings and wait for the surgeon to inquire about renal function. Option D. Suggest discontinuing the current anesthetic agent due to its potential nephrotoxicity. Correct answer is A. Alert the surgeon to the observed changes in urine output and serum creatinine, and recommend a review of intraoperative fluid management and potential nephrotoxic agents. Explanation. This scenario is professionally challenging because it requires the surgical assistant to interpret complex physiological data related to kidney function in the context of a surgical procedure. Accurate assessment is critical for patient safety and optimal surgical outcomes. The surgical assistant must demonstrate a thorough understanding of renal physiology and its implications during surgery, ensuring that interventions are appropriate and timely. The correct approach represents best professional practice because it directly addresses the observed physiological changes by correlating them with known kidney functions and potential surgical impacts. This aligns with the ABSA emphasis on evidence-based practice and the assistant's role in supporting the surgical team's decision-making through accurate physiological monitoring and interpretation. Adhering to established protocols for monitoring renal function during surgery, which includes evaluating urine output, electrolyte balance, and hemodynamic status, is paramount. This approach ensures that any deviations from normal are promptly identified and addressed, minimizing the risk of acute kidney injury or other complications. An incorrect approach that focuses solely on a single, isolated parameter without considering the broader physiological context is professionally unacceptable. For instance, solely relying on urine output without assessing hydration status or blood pressure could lead to misinterpretation and inappropriate interventions. This fails to meet the standard of comprehensive patient assessment expected of a certified surgical assistant. Another incorrect approach that involves making independent therapeutic decisions without consulting the surgeon or surgical team violates the established chain of command and the assistant's scope of practice. This represents a significant ethical and regulatory failure, as it undermines the collaborative nature of surgical care and could lead to patient harm. The professional reasoning process for similar situations involves a systematic evaluation of all available data, a clear understanding of normal physiological parameters, and the ability to recognize deviations. It requires constant communication with the surgical team, particularly the surgeon, to discuss findings and proposed actions. The surgical assistant must always operate within their defined scope of practice and adhere to institutional policies and ABSA guidelines, prioritizing patient safety above all else. Question 5. Upon reviewing the intraoperative monitoring data for a patient undergoing a carotid endarterectomy, the surgical assistant observes a sudden drop in blood pressure and a significant decrease in heart rate. The surgeon is actively dissecting near the carotid sinus. Which of the following immediate actions best reflects a proactive and physiologically informed response to this critical situation? Option A. Alert the surgeon to the vital sign changes and await specific instructions before taking any action. Option B. Continue with the current surgical dissection and document the observed vital sign changes in the operative record. Option C. Immediately reposition the patient to a Trendelenburg position to improve cerebral perfusion. Option D. Administer atropine intravenously and prepare for immediate suctioning of the airway while informing the surgeon of the observed physiological changes. Correct answer is D. Administer atropine intravenously and prepare for immediate suctioning of the airway while informing the surgeon of the observed physiological changes. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of human physiology and the potential for rapid deterioration in a patient's condition. Surgical assistants must possess a comprehensive understanding of how different body systems interact and how surgical interventions can impact these systems. The challenge lies in anticipating potential complications, recognizing subtle signs of distress, and implementing appropriate interventions swiftly and effectively, all while adhering to established protocols and the surgeon's directives. The need for precise knowledge of anatomical structures and physiological responses is paramount to patient safety. Correct approach analysis. The correct approach demonstrates a deep understanding of the patient's cardiovascular system and its response to surgical manipulation. Recognizing the potential for vagal stimulation during dissection near the carotid sinus, and implementing immediate interventions like atropine administration and pressure reduction directly addresses the physiological cause of the observed bradycardia and hypotension. This aligns with best professional practice by prioritizing patient stability, utilizing pharmacological knowledge to counteract a specific physiological event, and acting decisively to prevent further compromise. This proactive and informed response is critical in surgical settings where patient status can change rapidly. Incorrect approach is analysis. One incorrect approach involves solely relying on the surgeon's immediate verbal command without independently assessing the patient's physiological status. This fails to acknowledge the surgical assistant's role in continuous patient monitoring and proactive intervention. It represents a failure to exercise independent clinical judgment and could delay critical treatment for a deteriorating patient, potentially violating standards of care that expect vigilance and timely response. Another incorrect approach, focusing on documenting the event without immediate intervention, is a significant regulatory and ethical failure. While accurate documentation is crucial, it is secondary to immediate patient care. This approach prioritizes administrative tasks over life-saving actions, demonstrating a lack of understanding of emergency response protocols and the fundamental duty to preserve life and prevent harm. A third incorrect approach, suggesting a change in surgical position without a clear physiological rationale for the observed symptoms, is also professionally unacceptable. While positional changes can sometimes influence hemodynamics, it is not the primary or most effective intervention for acute bradycardia and hypotension caused by vagal stimulation. This approach lacks a targeted understanding of the underlying pathophysiology and could waste valuable time that should be spent on direct medical management. Professional reasoning. Professionals should approach such situations by first conducting a rapid, systematic assessment of the patient's vital signs and overall condition. This involves recognizing deviations from baseline and understanding the potential physiological causes. Next, they should correlate these findings with the ongoing surgical procedure and the patient's known medical history. Based on this assessment, they should formulate a differential diagnosis for the observed changes and identify the most appropriate immediate interventions. This decision-making process requires a strong foundation in human body systems, pharmacology, and surgical procedures, coupled with the ability to communicate effectively with the surgical team and act decisively within their scope of practice. Adherence to institutional policies and ABSA certification standards, which emphasize patient safety and competent practice, is essential. Question 6. The audit findings indicate a need to reinforce understanding of the fundamental cellular components and processes of the nervous system relevant to surgical intervention. Which of the following best describes the primary functional role of the myelin sheath in a neuron's ability to transmit an electrical signal? Option A. The myelin sheath facilitates the direct exchange of ions across the axonal membrane, thereby initiating the action potential. Option B. The myelin sheath acts as an electrical insulator, significantly increasing the speed of action potential propagation along the axon through saltatory conduction. Option C. The myelin sheath serves as a structural support for the axon, preventing its physical damage during surgical manipulation. Option D. The myelin sheath is responsible for the synthesis of neurotransmitters at the synaptic terminal. The correct answer is B. The myelin sheath acts as an electrical insulator, significantly increasing the speed of action potential propagation along the axon through saltatory conduction. Explanation. The audit findings indicate a potential gap in the understanding and application of fundamental neuroanatomy and neurophysiology as it pertains to surgical assisting. This scenario is professionally challenging because the surgical assistant's role requires a precise understanding of the anatomical structures and physiological processes involved in surgical procedures to ensure patient safety and optimal outcomes. Misinterpreting or lacking knowledge of neuron structure and function can lead to errors in instrument handling, positioning, or anticipation of surgical events, potentially compromising the surgical field or patient well-being. Careful judgment is required to identify and rectify such knowledge gaps promptly. The correct approach represents best professional practice because it directly addresses the identified deficiency through a structured, evidence-based learning process aligned with the standards expected for certification. This involves reviewing foundational knowledge of neuron structure, e.g., dendrites, soma, axon, myelin sheath, and function, e.g., action potential propagation, synaptic transmission, as it relates to surgical interventions. This proactive and comprehensive review ensures the surgical assistant can accurately identify neural structures, understand their susceptibility to surgical manipulation, and anticipate physiological responses, thereby upholding the highest standards of patient care and professional competence as mandated by the American Board of Surgical Assistants. ABSA certification requirements. An incorrect approach that focuses solely on memorizing surgical procedures without understanding the underlying neural mechanisms is professionally unacceptable. This failure stems from a lack of deep understanding, which is a prerequisite for effective surgical assisting. It neglects the critical need to comprehend how surgical actions might impact neural pathways, potentially leading to inadvertent nerve damage or functional deficits, a direct violation of the ABSA emphasis on patient safety and competent practice. Another incorrect approach that relies on anecdotal experience or the guidance of colleagues without consulting authoritative sources is also professionally deficient. While collaboration is valuable, it cannot substitute for a thorough, systematic review of established scientific principles and regulatory guidelines. This approach risks perpetuating misinformation or incomplete knowledge, failing to meet the rigorous standards of the ABSA certification, which demands a verifiable and comprehensive understanding of the subject matter. Finally, an approach that dismisses the audit findings as insignificant or irrelevant is a grave professional error. Such an attitude demonstrates a lack of commitment to continuous learning and professional development, which are core tenets of surgical assisting. It ignores the potential for adverse patient outcomes and fails to adhere to the spirit and letter of the ABSA commitment to maintaining a highly qualified and knowledgeable surgical assistant workforce. The professional decision-making process for similar situations should involve acknowledging audit findings, conducting a thorough self-assessment of knowledge gaps, consulting relevant ABSA-approved educational materials and professional literature, and actively engaging in targeted learning to address identified deficiencies. This iterative process of assessment, learning, and application ensures ongoing competence and adherence to professional standards. Question 7. Examination of the data shows a patient scheduled for a laparoscopic cholecystectomy has a documented allergy to latex. Standard surgical kits for this procedure typically contain latex components. The surgical assistant has reviewed the patient's chart and is aware of the allergy. What is the most appropriate immediate action for the surgical assistant to take regarding preoperative preparation? Option A. Inform the surgeon of the allergy and recommend postponing the procedure until a comprehensive review of all potential latex exposures can be completed. Option B. Ensure that the surgical team is informed of the latex allergy and confirm that latex-free equipment and supplies will be utilized for the procedure. Option C. Rely on the nursing staff to identify and procure latex-free alternatives without direct confirmation from the surgical assistant. Option D. Proceed with the procedure as scheduled, assuming the surgical team is aware and has made necessary arrangements for latex-free equipment. Correct answer is B. Ensure that the surgical team is informed of the latex allergy and confirm that latex-free equipment and supplies will be utilized for the procedure. Explanation. The scenario presents a common challenge in preoperative preparation. A patient with a known allergy to latex is scheduled for a procedure where latex-containing equipment is standard. The professional challenge lies in ensuring patient safety by proactively identifying and mitigating potential risks, which requires a thorough understanding of the patient's medical history and the available resources. Careful judgment is required to balance standard practice with individual patient needs and potential adverse reactions. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols for managing allergies. By proactively communicating the allergy to the surgical team and ensuring the availability of latex-free alternatives, the surgical assistant upholds the principle of do no harm and complies with the American Board of Surgical Assistants (ABSA) guidelines, which emphasize thorough preoperative assessment and risk management. This approach aligns with the ethical obligation to advocate for the patient and ensure their well-being throughout the perioperative process. An incorrect approach that involves proceeding with the surgery without explicitly confirming latex-free equipment availability fails to adequately address the known allergy. This constitutes a regulatory and ethical failure by potentially exposing the patient to a significant allergen, which could lead to a severe anaphylactic reaction. This demonstrates a lack of due diligence in preoperative preparation and a disregard for patient-specific needs. Another incorrect approach, which is to assume that the surgical team is aware and has already made accommodations, is also professionally unacceptable. While the surgical team should be informed, relying on assumption rather than explicit confirmation is a critical oversight. This can lead to a breakdown in communication and a failure to implement necessary precautions, violating the ABSA emphasis on clear and documented communication regarding patient allergies. A further incorrect approach, which is to delay the procedure solely based on the allergy without exploring all available alternatives, might be considered if no latex-free options exist or if the risk is deemed unmanageable. However, in most modern surgical settings, latex-free alternatives are readily available. The failure here lies in not first attempting to mitigate the risk through established protocols and available resources, which is a core tenet of preoperative preparation. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's medical record for any documented allergies, especially to medications, latex, or other materials. 2. If an allergy is identified, immediately communicate this information to the surgeon, anesthesiologist, and nursing staff. 3. Proactively inquire about and confirm the availability of necessary latex-free equipment and supplies for the planned procedure. 4. Document all communications and confirmed accommodations in the patient's chart. 5. If there are any doubts or concerns about managing the allergy, escalate the issue to the appropriate personnel for further consultation and decision-making. Question 8. Performance analysis shows a surgical team preparing for a pelvic procedure where the patient's chart indicates a history of gender-affirming surgery. The surgical assistant is tasked with preparing the instrument table and anticipating the surgeon's needs. Considering the potential for anatomical variations, which of the following actions best demonstrates adherence to best practices in surgical assistance regarding male and female pelvic anatomy? Option A. Relying solely on the surgeon's verbal directives during the procedure to identify anatomical structures, without independent preoperative or intraoperative anatomical confirmation. Option B. Proceeding with standard instrument preparation for a typical male pelvis, assuming the patient's legal sex designation dictates the primary anatomical considerations. Option C. Preparing instruments for both typical male and female pelvic anatomy simultaneously, without specific preoperative assessment, to cover all possibilities. Option D. Reviewing the patient's preoperative imaging and consulting with the surgeon regarding any anticipated anatomical variations specific to the patient's surgical history before the procedure begins. The correct answer is D. Reviewing the patient's preoperative imaging and consulting with the surgeon regarding any anticipated anatomical variations specific to the patient's surgical history before the procedure begins. Explanation. This scenario presents a professional challenge due to the need for precise anatomical knowledge in a critical surgical context. The surgical assistant must accurately identify and differentiate between male and female pelvic anatomy to ensure the correct instruments and techniques are applied, minimizing the risk of iatrogenic injury. The ABSA certification emphasizes a strong foundation in surgical anatomy, and failure to demonstrate this competency can have serious patient safety implications. The correct approach involves a thorough preoperative review of the patient's chart, including imaging, to confirm anatomical characteristics and anticipate any variations. During the procedure, the surgical assistant must actively observe and confirm the surgeon's identification of anatomical landmarks, utilizing their knowledge of typical male and female pelvic structures. This proactive engagement and confirmation align with the ABSA commitment to patient safety and the ethical obligation to provide competent care. It reflects best professional practice by prioritizing patient well-being through meticulous attention to anatomical detail and collaborative communication with the surgical team. An incorrect approach would be to assume the anatomy based on the patient's name or perceived gender presentation without objective confirmation. This assumption bypasses the critical step of verifying anatomical specifics, which is a direct violation of the principle of due diligence in patient care. Ethically, it demonstrates a lack of professional responsibility and a failure to uphold the standards of practice expected of a certified surgical assistant. Another incorrect approach would be to rely solely on the surgeon's verbal cues without independent anatomical verification. While teamwork is crucial, the surgical assistant has a responsibility to possess and apply their own anatomical knowledge to identify potential discrepancies or confirm critical structures, thereby acting as an additional layer of safety. This failure to independently confirm anatomical structures could lead to errors if the surgeon makes an incorrect identification. The professional decision-making process for similar situations should involve a systematic approach. 1. Preoperative assessment. Review all available patient data, including imaging, to understand the expected anatomy. 2. Intraoperative vigilance. Continuously observe and confirm anatomical structures as they are identified and manipulated. 3. Knowledge application. Utilize comprehensive knowledge of male and female anatomy to anticipate and identify structures. 4. Communication. Clearly and concisely communicate any observations or concerns to the surgeon. 5. Confirmation. Ensure all critical anatomical identifications are confirmed before proceeding with definitive surgical steps. Question 9. Quality control measures reveal inconsistent Doppler flow signals in a major peripheral artery during a complex vascular reconstruction procedure. The surgical assistant is responsible for monitoring these signals. Option A. Ignore the inconsistent Doppler flow signals as they are not directly related to the surgical assistant's primary tasks. Option B. Immediately inform the surgeon about the inconsistent Doppler flow signals. Option C. Continue with the planned surgical steps, assuming the signals are a temporary fluctuation. Option D. Wait for the surgeon to inquire about the Doppler signals before reporting them. The correct answer is B. Immediately inform the surgeon about the inconsistent Doppler flow signals. Explanation. Scenario analysis. This scenario presents a challenge in maintaining optimal patient outcomes during a surgical procedure involving significant vascular manipulation. The quality control finding of inconsistent Doppler flow signals necessitates immediate, informed decision-making to ensure adequate tissue perfusion and prevent potential complications such as ischemia or thrombosis. The surgical assistant's role is critical in recognizing the implications of such findings and contributing to the team's response. Correct approach analysis. The correct approach involves a systematic and collaborative assessment of the situation. Promptly alerting the surgeon to the inconsistent Doppler signals is paramount. This allows for immediate clinical evaluation and potential intervention. The surgical assistant's understanding of vascular anatomy and physiology, coupled with their observational skills, enables them to identify the deviation from expected findings. This aligns with the ABSA emphasis on patient safety and the surgical assistant's responsibility to support the surgical team in achieving optimal outcomes, adhering to established protocols for monitoring and reporting critical intraoperative events. Incorrect approach is analysis. Failing to report the inconsistent Doppler signals to the surgeon is a direct failure in communication and patient advocacy. This inaction could lead to delayed or missed interventions, potentially resulting in irreversible tissue damage or other serious complications, violating the ethical obligation to prioritize patient well-being. Assuming the Doppler signals are a temporary anomaly without further investigation or reporting demonstrates a lack of critical thinking and adherence to quality control principles. This assumption can lead to overlooking a significant underlying issue, such as developing thrombus or compromised vessel patency, which directly impacts patient safety. Proceeding with the planned surgical steps without addressing the concerning Doppler signals indicates a disregard for intraoperative monitoring and a failure to adapt to changing patient conditions. This approach prioritizes procedural progression over patient physiological status, which is contrary to the core principles of surgical care and the ABSA commitment to safe practice. Professional reasoning. Professionals facing such a scenario should employ a structured decision-making process. First, recognize and accurately interpret the observed data in consistent Doppler signals. Second, immediately communicate this critical finding to the responsible physician, the surgeon. Third, collaborate with the surgical team to assess the cause and determine the appropriate course of action, which may involve further diagnostic measures or procedural adjustments. This systematic approach ensures that patient safety remains the highest priority and that interventions are timely and evidence-based, reflecting the standards expected by the ABSA. Question 10. Analysis of a patient undergoing a laparoscopic cholecystectomy who suddenly exhibits increased respiratory rate, shallow breathing, and decreased oxygen saturation. The surgical assistant notes these changes while maintaining the surgical field. What is the most appropriate immediate action for the surgical assistant? Option A. Immediately alert the surgeon and anesthesia provider to the patient's respiratory changes and prepare for potential airway interventions. Option B. Attempt to suction the patient's airway independently to alleviate the breathing difficulty. Option C. Wait to see if the patient's respiratory status improves on its own before reporting the changes. Option D. Continue to focus on maintaining the surgical field, assuming the anesthesia provider will manage any respiratory issues. The correct answer is A. Immediately alert the surgeon and anesthesia provider to the patient's respiratory changes and prepare for potential airway interventions. Explanation. Scenario analysis. This scenario presents a common but critical challenge in surgical assisting, managing a patient experiencing acute respiratory distress during a procedure. The challenge lies in the immediate need for intervention, the potential for rapid deterioration, and the requirement for the surgical assistant to act decisively within their scope of practice and in collaboration with the surgical team, all while adhering to established protocols and patient safety guidelines. The assistant must quickly assess the situation, identify potential causes, and implement appropriate interventions without compromising the surgical field or patient stability. Correct approach analysis. The correct approach prioritizes immediate patient safety and adherence to established protocols. This involves recognizing the signs of respiratory distress, alerting the surgeon and anesthesia provider promptly, and preparing for immediate interventions such as suctioning or assisting with airway management. This aligns with the ABSA emphasis on patient advocacy, teamwork, and the surgical assistant's role in anticipating and responding to patient needs and potential complications. The surgical assistant's responsibility is to support the surgeon and the entire surgical team in maintaining optimal patient care, which includes vigilant monitoring of the patient's respiratory status and readiness to assist in managing airway emergencies. Incorrect approaches analysis. One incorrect approach involves delaying notification of the surgeon and anesthesia provider. This failure to communicate critical patient status changes violates the principle of teamwork and patient advocacy, potentially leading to delayed or inadequate intervention and patient harm. It also disregards the established chain of command and collaborative decision-making essential in surgical settings. Another incorrect approach is to attempt to manage the respiratory distress independently without consulting the surgeon or anesthesia provider. This exceeds the surgical assistant's scope of practice and bypasses the expertise of the individuals primarily responsible for airway management and overall patient care. Such an action could lead to inappropriate interventions, further compromise the patient's airway, and create a breakdown in team communication and coordination. A third incorrect approach is to focus solely on maintaining the surgical field while disregarding the patient's respiratory distress. While maintaining the sterile field is crucial, it cannot supersede the immediate life-saving needs of the patient. This demonstrates a failure in prioritizing patient safety and a lack of situational awareness, which are fundamental ethical and professional responsibilities of a surgical assistant. Professional reasoning. Surgical assistants must employ a systematic decision-making framework when faced with patient compromise. This framework includes 1. Vigilant patient monitoring for any signs of distress or change in status. 2. Immediate recognition and assessment of the observed change, e.g., respiratory distress. 3. Prompt and clear communication with the surgeon and anesthesia provider, reporting objective findings. 4. Anticipation of potential interventions and preparation of necessary equipment. 5. Acting within the defined scope of practice and under the direction of the surgeon. This structured approach ensures that patient safety remains paramount and that the surgical team functions cohesively to address emergent situations effectively. Question 11. The evaluation methodology shows a surgical assistant preparing for a thyroidectomy on a patient with a history of Graves' disease. The patient's recent laboratory results indicate elevated thyroid-stimulating hormone, TSH levels, and borderline low free thyroxine, FT4. The surgeon has not explicitly discussed the implications of these specific lab values with the assistant. Which of the following actions best demonstrates the surgical assistant's adherence to best professional practice in this endocrine-related surgical scenario? Option A. Immediately consult with the surgeon to discuss the implications of the elevated TSH and borderline low FT4 levels, and inquire about any necessary preoperative adjustments to the patient's management plan. Option B. Inform the circulating nurse about the lab results and ask them to relay the information to the surgeon at their convenience. Option C. Proceed with the surgical preparation as scheduled, assuming the surgeon has accounted for the patient's endocrine status. Option D. Focus solely on the surgical instruments and equipment, as the patient's endocrine status is the surgeon's primary responsibility. The correct answer is C. Proceed with the surgical preparation as scheduled, assuming the surgeon has accounted for the patient's endocrine status. Explanation. This scenario presents a professional challenge due to the critical nature of endocrine disorders and their impact on surgical outcomes, requiring a surgical assistant to possess a comprehensive understanding of hormonal regulation and its clinical implications. The need for precise patient assessment and intervention in the context of potential surgical complications related to endocrine imbalances demands meticulous attention to detail and adherence to established protocols. The correct approach represents best professional practice because it prioritizes a thorough preoperative assessment of the patient's endocrine status, including a review of relevant laboratory values and imaging. This aligns with the American Board of Surgical Assistants, ABSA certification standards, which emphasize the importance of understanding patient pathophysiology and its impact on surgical management. By proactively identifying potential endocrine-related risks, the surgical assistant can contribute to informed decision-making, anticipate intraoperative challenges, and ensure appropriate post-operative care, thereby optimizing patient safety and surgical outcomes. This proactive stance is a cornerstone of ethical surgical assistance, ensuring that all relevant patient factors are considered. An incorrect approach that involves proceeding with surgery without a comprehensive review of the patient's endocrine status and recent laboratory results would represent a significant regulatory and ethical failure. This oversight could lead to unexpected intraoperative complications, such as glycemic instability or electrolyte imbalances, which could be exacerbated by surgical stress. Such a failure violates the ABSA mandate for competent patient care and the ethical obligation to act in the patient's best interest. Another incorrect approach, such as relying solely on the surgeon's verbal confirmation of the patient's endocrine stability without independent verification of current data, is also professionally unacceptable. While collaboration with the surgeon is vital, the surgical assistant has a responsibility to ensure they have a complete and accurate understanding of the patient's condition. This approach neglects the assistant's role in patient advocacy and risk mitigation, potentially leading to suboptimal care. A third incorrect approach, which might involve delaying necessary endocrine-specific interventions due to a lack of perceived urgency, would also be a failure. Endocrine imbalances can have profound effects on surgical healing and recovery. Ignoring or downplaying these factors, even if seemingly stable at a glance, can lead to delayed diagnosis of complications or prolonged recovery periods, contravening the principles of efficient and effective patient management. The professional reasoning process for similar situations should involve a systematic preoperative checklist that includes a thorough review of the patient's medical history, current medications, recent laboratory data, specifically focusing on relevant endocrine markers, and any imaging studies that might indicate endocrine-related pathology. This should be followed by a clear communication protocol with the surgical team to discuss any identified concerns and to ensure a shared understanding of the patient's endocrine status and potential implications for the planned procedure. The surgical assistant should feel empowered to raise questions and seek clarification to ensure patient safety and optimal surgical outcomes. Question 12. The monitoring system demonstrates a visual field focused on the distal stomach and the initial segment of the small intestine. The surgeon asks for confirmation of the anatomical structure immediately following the stomach's exit. The surgical assistant observes a thickened muscular ring at this junction, leading into a C-shaped structure. Which anatomical landmark is most accurately described by this observation? Option A, the ampulla of Vater. Option B, the pylorus. Option C, the duodenal bulb. Option D, the ligament of Treitz. The correct answer is B, the pylorus. Explanation. This scenario presents a challenge in accurately identifying anatomical structures within the gastrointestinal tract during a surgical procedure, which directly impacts patient safety and the effectiveness of the intervention. The surgical assistant's role is critical in providing precise information to the surgeon. Adherence to established anatomical knowledge and surgical protocols is paramount. The correct approach involves a thorough understanding of the standard anatomical landmarks of the gastrointestinal tract, specifically differentiating between the pylorus and the duodenum. The pylorus is the distal opening of the stomach that connects to the duodenum. The duodenum is the first part of the small intestine, immediately following the stomach. Accurate identification ensures that surgical interventions are performed on the correct segment, preventing unintended damage or misapplication of techniques. This aligns with the ABSA emphasis on foundational surgical knowledge and patient care standards, which implicitly require precise anatomical identification as a prerequisite for safe surgical assistance. An incorrect approach would be to rely on assumptions or incomplete visual cues. For instance, mistaking the pyloric sphincter for the duodenal bulb, or vice versa, could lead to incorrect instrument placement or tissue manipulation. This demonstrates a failure to meet the expected standard of anatomical knowledge for a certified surgical assistant. Such an error could result in iatrogenic injury, necessitate revision procedures, and violate the ethical obligation to provide competent care. Furthermore, it would contraindicate the principles of evidence-based practice and patient safety that underpin surgical certification. The professional decision-making process in such situations should involve a systematic approach. First, confirm visual identification against known anatomical landmarks. Second, if uncertainty persists, communicate this to the surgeon for clarification or confirmation. And third, consult intraoperative imaging or surgical atlases if readily available and appropriate. This layered approach prioritizes patient safety and ensures that all actions are based on accurate anatomical understanding. Question 13. Research into the critical importance of maintaining a sterile field during surgical procedures has led to the development of strict protocols. During a complex abdominal surgery, the surgeon, under pressure, asks the surgical assistant to hand them a specific instrument that has inadvertently touched the edge of the sterile drape. The assistant recognizes this as a breach of sterile technique. What is the most appropriate course of action for the surgical assistant? Option A. Continue with the procedure as if the incident did not occur, focusing solely on assisting the surgeon with the next step. Option B. Discreetly place the contaminated instrument aside without comment and retrieve a sterile one, hoping the surgeon does not notice. Option C. Politely inform the surgeon that the instrument has touched the sterile drape and request a sterile replacement, explaining the concern for maintaining the sterile field. Option D. Immediately hand the instrument to the surgeon as requested, assuming the surgeon is aware of the situation and has a reason for the request. The correct answer is C. Politely inform the surgeon that the instrument has touched the sterile drape and request a sterile replacement, explaining the concern for maintaining the sterile field. Explanation. This scenario presents a professional challenge due to the inherent conflict between a surgeon's direct instruction and the surgical assistant's responsibility to maintain sterile technique and patient safety. The surgical assistant must exercise independent judgment, even when faced with a direct order from a superior, if that order compromises established protocols or patient well-being. The core of the challenge lies in balancing respect for the surgeon's authority with the ethical and regulatory obligations of the surgical assistant. The correct approach represents best professional practice because it prioritizes patient safety and adherence to sterile principles, which are paramount in surgical settings and are implicitly or explicitly supported by ABSA ethical guidelines and the general principles of surgical patient care. By questioning the surgeon's request and seeking clarification, or an alternative solution that upholds sterility, the assistant demonstrates a commitment to professional standards and patient advocacy. This aligns with the ABSA emphasis on maintaining a safe surgical environment and acting with integrity. An incorrect approach of immediately complying with the surgeon's request without question would be a significant regulatory and ethical failure. Bypasses established sterile field protocols, increasing the risk of surgical site infection, which is a direct violation of patient safety standards. Ethically, it demonstrates a lack of professional responsibility to advocate for the patient's well-being when a deviation from best practice is observed. Another incorrect approach, such as ignoring the instruction and proceeding with a different action without communication, be a failure in professional communication and teamwork, potentially leading to confusion and errors. It also fails to address the underlying issue of the surgeon's request. The professional decision-making process in such situations should involve a rapid assessment of the situation, identifying the potential risks associated with the surgeon's request. The assistant should then calmly and respectfully communicate their concern, referencing established protocols or potential risks. If the surgeon insists, the assistant should escalate the concern to a charge nurse or other appropriate supervisor if patient safety remains compromised and the situation cannot be resolved directly. This process emphasizes clear communication, adherence to standards, and patient advocacy. Question 14. The assessment process reveals a post-operative patient experiencing significant discomfort and an inability to void, approximately 6 hours after a major abdominal surgery. The surgical assistant is aware of the patient's history of urinary tract issues. What is the most appropriate immediate action for the surgical assistant to take regarding the patient's urinary status? Option A. Ask a nursing assistant to monitor the patient's urinary output and report back in a few hours, as the surgical assistant has other immediate responsibilities. Option B. Proceed to insert a urinary catheter to relieve the patient's discomfort and facilitate urine output, as the assistant has observed this procedure before. Option C. Document the patient's reported discomfort and inability to void, and immediately notify the supervising surgeon of the findings and concerns. Option D. Continue with routine post-operative tasks, assuming the patient will eventually void on their own, as is common after surgery. The correct answer is C. Document the patient's reported discomfort and inability to void, and immediately notify the supervising surgeon of the findings and concerns. Explanation. The scenario presents a common challenge in surgical assisting, managing patient care within the established scope of practice and adhering to regulatory guidelines, specifically those set forth by the American Board of Surgical Assistants, ABSA. The challenge lies in balancing the immediate needs of the patient with the defined responsibilities and limitations of the surgical assistant role, ensuring patient safety and legal compliance. Careful judgment is required to avoid overstepping boundaries or neglecting essential duties. The correct approach represents best professional practice because it aligns with the ABSA emphasis on the surgical assistant's role in direct patient care, including monitoring and reporting. Specifically, the ABSA certification implies adherence to standards that prioritize patient well-being and the assistant's contribution to the surgical team's effectiveness. This approach demonstrates an understanding of the urinary system's importance in post-operative recovery and the assistant's responsibility to observe and communicate relevant patient status changes to the supervising surgeon. This proactive monitoring and reporting are crucial for early detection of complications, such as urinary retention or infection, which fall within the scope of a surgical assistant's observational and reporting duties. An incorrect approach that involves ignoring the patient's discomfort and focusing solely on other tasks would be professionally unacceptable. This failure to observe and report a potential post-operative complication related to the urinary system directly violates the principle of patient advocacy and the surgical assistant's duty of care. It could lead to delayed diagnosis and treatment, potentially resulting in adverse patient outcomes and a breach of professional standards. Another incorrect approach, such as independently initiating a urinary catheterization without a physician's order or specific protocol, would exceed the typical scope of practice for a surgical assistant as defined by ABSA. While the assistant may be involved in assisting with such procedures, independent initiation without proper authorization constitutes an unauthorized medical act, posing significant legal and ethical risks. This bypasses the established chain of command and the physician's ultimate responsibility for patient treatment decisions. Finally, an incorrect approach that involves delegating the monitoring of urinary output to an unlicensed individual without proper supervision or established protocols would also be professionally unacceptable. Surgical assistants are accountable for the patient care tasks within their purview, and improper delegation can compromise patient safety and violate regulatory requirements for supervision and accountability. The professional reasoning process should involve a systematic evaluation of the patient's condition, the established surgical plan, the assistant's scope of practice as defined by ABSA, and the need for clear communication with the surgical team. When faced with a patient exhibiting signs of urinary distress post-operatively, the surgical assistant should first assess the situation within their observational capabilities, then promptly report their findings to the supervising surgeon and await further direction. This ensures that patient care decisions are made by the appropriate authority and that the assistant acts within their defined role to support optimal patient outcomes. Question 15. Governance review demonstrates that current post-operative monitoring protocols for surgical patients are based on outdated guidelines, potentially impacting early detection of complications. As a surgical assistant, what is the most appropriate process optimization approach to address this discrepancy? Option A. Immediately implement enhanced monitoring techniques for all post-operative patients under your direct care, irrespective of existing institutional protocols, to ensure optimal patient safety. Option B. Initiate a formal proposal to the surgical department's Quality Improvement Committee, presenting evidence-based recommendations for updating the post-operative monitoring protocols to align with current best practices and regulatory standards. Option C. Discuss your concerns with individual surgeons and nurses, encouraging them to independently adopt more rigorous monitoring practices when they deem it necessary for their patients. Option D. Continue to follow the existing post-operative monitoring protocols without deviation, assuming they are sufficient until a formal directive for change is issued by higher administration. The correct answer is B. Initiate a formal proposal to the surgical department's Quality Improvement Committee, presenting evidence-based recommendations for updating the post-operative monitoring protocols to align with current best practices and regulatory standards. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings where established protocols for patient monitoring may not fully align with evolving best practices or specific patient needs. The professional challenge lies in balancing adherence to existing governance structures with the imperative to provide optimal patient care, particularly in the critical post-operative period, where subtle changes can indicate significant complications. Surgical assistants must exercise sound judgment in assessing the adequacy of current monitoring and advocating for necessary adjustments. Correct approach analysis. The correct approach involves a proactive and collaborative engagement with the established governance structure. By initiating a review of current monitoring protocols and proposing evidence-based enhancements, the surgical assistant demonstrates a commitment to process optimization and patient safety, which are core tenets of professional practice and regulatory compliance. This approach respects the hierarchical and procedural nature of healthcare governance, while advocating for improvements that directly benefit patient outcomes. It aligns with the ABSA emphasis on maintaining and improving the quality of surgical care through continuous assessment and adaptation of practices. Incorrect approaches analysis. One incorrect approach involves bypassing established governance channels and unilaterally implementing changes to patient monitoring. This is a regulatory and ethical failure because it undermines the authority of the governing body, potentially creates inconsistencies in care delivery across the institution, and fails to ensure that any new protocols have undergone proper vetting for safety and efficacy. It disregards the collaborative nature of healthcare decision-making and can lead to confusion and liability. Another incorrect approach is to accept the current monitoring protocols without question, even if there is a perceived or observed inadequacy. This represents a failure to uphold the professional responsibility to advocate for optimal patient care and to contribute to the continuous improvement of healthcare processes. It can lead to suboptimal outcomes, delayed recognition of complications, and a failure to meet the evolving standards of surgical assistance as promoted by certifying bodies like the ABSA. A third incorrect approach is to focus solely on individual patient needs without considering the broader systemic implications or the established institutional policies. While patient-centered care is paramount, effective monitoring and assessment are often system-dependent. Ignoring existing protocols or failing to seek institutional approval for deviations can lead to fragmented care, potential conflicts with other healthcare providers, and a failure to contribute to standardized, high-quality care across the surgical service. Professional reasoning. Professionals should approach situations requiring process optimization by first understanding the existing framework. This involves familiarizing oneself with current policies and procedures. When an opportunity for improvement is identified, the next step is to gather evidence supporting the proposed change, such as research findings or best practice guidelines. The professional should then engage with the appropriate governance bodies or supervisors, presenting the evidence and rationale for the proposed optimization. This collaborative and evidence-based approach ensures that changes are implemented safely, effectively, and in alignment with regulatory and ethical standards. Question 16. Which approach would be most appropriate when encountering unexpectedly free blood tissue during an intraoperative dissection requiring meticulous hemostasis? Option A. Employing fine-tipped instruments with controlled electrocautery for precise dissection and hemostasis. Option B. Relying solely on topical hemostatic agents to control bleeding without altering dissection technique. Option C. Continuing with the original dissection plan using standard instruments without modification. Option D. Utilizing aggressive blunt dissection to quickly separate tissue planes. The correct answer is A. Employing fine-tipped instruments with controlled electrocautery for precise dissection and hemostasis. Explanation. This scenario presents a common intraoperative challenge where unexpected tissue friability necessitates immediate adaptation of surgical technique to ensure patient safety and optimal surgical outcome. The challenge lies in maintaining hemostasis and tissue integrity while proceeding with the planned procedure in a compromised surgical field. Careful judgment is required to select a technique that minimizes further trauma and bleeding without compromising the efficacy of the intervention. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established surgical principles. Utilizing a meticulous dissection technique with appropriate instrumentation, such as fine-tipped instruments and controlled electrocautery, directly addresses the tissue friability. This method minimizes iatrogenic injury, reduces the risk of uncontrolled bleeding, and allows for precise execution of the surgical steps. This aligns with the ABSA emphasis on competent surgical assistance, which includes adapting to intraoperative challenges in a manner that upholds the highest standards of patient care and surgical integrity. An incorrect approach involving aggressive manipulation or the use of blunt dissection in friable tissue would lead to increased tearing, uncontrolled hemorrhage, and potentially necessitate a more extensive or complex repair, thereby compromising patient safety and increasing operative time and morbidity. This would be a failure to exercise the necessary skill and judgment expected of a surgical assistant. Another incorrect approach, such as proceeding with the original plan without modification, ignores the observed intraoperative conditions and risks significant complications. This demonstrates a lack of critical observation and adaptive problem solving, which are fundamental to safe surgical practice and are implicitly expected under the ABSA certification standards. Relying solely on hemostatic agents without addressing the underlying technical issue of tissue handling would also be an inadequate response, as it fails to resolve the root cause of the bleeding and may mask more significant tissue damage. Professionals should employ a decision-making framework that begins with thorough intraoperative assessment. Upon identifying tissue friability, the assistant should immediately communicate these findings to the surgeon. The decision-making process then involves collaboratively evaluating alternative dissection techniques, instrument choices, and hemostatic strategies that are best suited to the compromised tissue. This iterative process of assessment, communication, and adaptation ensures that the surgical plan remains aligned with the patient's evolving intraoperative condition, prioritizing safety and efficacy. Question 17. The review process indicates that during a surgical procedure, a surgical assistant observes a potential breach in aseptic technique when a sterile instrument momentarily touches the edge of the non-sterile surgical drape. The assistant is confident in their understanding of aseptic principles, but is unsure of the immediate best course of action to ensure patient safety and maintain the integrity of the sterile field. Which of the following actions best reflects adherence to ABSA certification standards for aseptic technique? Option A. Immediately inform the surgeon of the observed potential breach and await their instruction on how to proceed. Option B. Discreetly attempt to reposition the instrument without alerting the surgical team, assuming the contact was minimal. Option C. Remove the instrument from the sterile field and replace it with a new one without consulting the surgeon. Option D. Continue with the procedure, considering the contact with the drape to be insignificant and unlikely to cause contamination. The correct answer is A. Immediately inform the surgeon of the observed potential breach and await their instruction on how to proceed. Explanation. Scenario analysis. This scenario is professionally challenging because maintaining aseptic technique is paramount to patient safety and preventing surgical site infections. A lapse in aseptic technique, even if seemingly minor, can have severe consequences for the patient, leading to prolonged hospital stays, additional treatments, and increased healthcare costs. The surgical assistant must constantly be vigilant and possess a thorough understanding of aseptic principles to identify and correct potential breaches. Correct approach analysis. The correct approach demonstrates a proactive and informed understanding of aseptic technique as mandated by the American Board of Surgical Assistants, ABSA, guidelines, and standard surgical practice. By immediately addressing the potential breach and consulting the surgeon, the assistant upholds the highest standards of patient care and adheres to the principle of when in doubt, ask. This aligns with ABSA emphasis on maintaining a sterile field and preventing contamination. Ensuring patient safety is the absolute priority. Incorrect approaches analysis. One incorrect approach involves ignoring the observed breach. This directly violates the fundamental principles of aseptic technique and ABSA emphasis on maintaining a sterile environment. Such inaction creates a significant risk of patient harm through infection and represents a failure to uphold professional responsibility. Another incorrect approach is to attempt to correct the breach without consulting the surgeon. While the intention might be to resolve the issue quickly, this bypasses the surgeon's ultimate responsibility for the operative field and could lead to an inappropriate or insufficient correction, potentially compromising sterility further. ABSA guidelines stress clear communication and collaboration within the surgical team. A third incorrect approach is to assume the breach is insignificant and proceed without any action. This demonstrates a lack of understanding of the cumulative risk associated with even minor breaches in aseptic technique. The sterile field is a continuous entity, and any break, however small, can introduce pathogens. This approach fails to meet the rigorous standards expected of a certified surgical assistant. Professional reasoning. Professionals facing such situations should employ a decision-making process rooted in patient safety and adherence to established protocols. This involves 1. Immediate identification of a potential breach in aseptic technique. 2. Assessment of the severity and potential impact of the breach. 3. Proactive communication with the surgeon to report the observation and seek guidance. 4. Collaborative decision-making on the appropriate corrective action. 5. Documentation of the event and actions taken, if necessary. This systematic approach ensures that patient well-being remains the primary concern and that all actions are aligned with regulatory requirements and best practices. Question 18. The analysis reveals a patient in the immediate postoperative period reporting increasing incisional pain that is not fully managed by the prescribed oral analgesic. The surgical assistant observes no overt signs of bleeding or wound dehiscence during a visual inspection. What is the most appropriate course of action for the surgical assistant? Option A. Document the patient's complaint of pain but defer further action until the surgeon makes their routine postoperative rounds. Option B. Advise the patient to rest and try to ignore the pain, as some discomfort is expected after surgery. Option C. Administer an additional dose of the prescribed oral analgesic, assuming the patient's pain tolerance is higher than anticipated. Option D. Perform a thorough reassessment of the patient's vital signs, pain level using a validated scale, and the surgical dressing for any signs of drainage or compromise, and then communicate findings and concerns to the surgeon for further orders. The correct answer is D. Perform a thorough reassessment of the patient's vital signs, pain level using a validated scale, and the surgical dressing for any signs of drainage or compromise, and then communicate findings and concerns to the surgeon for further orders. Explanation. The analysis reveals a common postoperative scenario where a surgical assistant must navigate patient comfort, potential complications, and established protocols. The professional challenge lies in balancing immediate patient needs with the long-term implications of care, all while adhering to the strict guidelines set forth by the American Board of Surgical Assistants, ABSA. This requires a deep understanding of postoperative care principles and the ability to apply them judiciously. The correct approach represents best professional practice because it prioritizes patient safety and well-being. By initiating a systematic assessment and intervention based on objective findings and established protocols, this aligns with the ABSA emphasis on evidence-based practice and the surgical assistant's role in monitoring patient recovery. Promptly addressing the patient's reported discomfort through a comprehensive evaluation, including vital signs and wound assessment, is crucial for identifying potential issues like infection, hematoma, or inadequate pain management. Implementing appropriate interventions, such as adjusting pain medication or notifying the surgeon, directly addresses the patient's immediate needs and prevents potential complications. This proactive and systematic approach is a cornerstone of safe and effective postoperative care, as mandated by professional standards and ethical obligations. An incorrect approach that involves delaying assessment or solely relying on the patient's verbal report without objective verification, fails to meet the standard of care. This could lead to a misdiagnosis of a serious complication, potentially resulting in patient harm and violating the ABSA mandate for diligent patient monitoring. Another incorrect approach, such as administering medication without a physician's order or without a clear protocol, constitutes a significant regulatory and ethical failure. This bypasses the established chain of command and could lead to medication errors or adverse drug reactions, directly contravening guidelines on scope of practice and patient safety. Furthermore, ignoring the patient's reported pain or discomfort without a thorough investigation is a failure to uphold the ethical principle of beneficence and could be seen as a breach of professional responsibility. The professional reasoning process for similar situations should involve a structured approach. 1. Assess the patient's reported symptoms and observe for objective signs. 2. Compare findings with expected post-operative recovery parameters and established protocols. 3. Consult relevant resources or colleagues if uncertainty exists. 4. Communicate findings and proposed interventions to the supervising surgeon. 5. Implement interventions as ordered or per protocol, ensuring patient safety and comfort are paramount. This systematic decision-making framework ensures that all critical aspects of patient care are considered, leading to optimal outcomes and adherence to professional standards. Question 19. Compliance review shows a surgical assistant is responsible for performing post-operative dressing changes on a patient with a complex surgical wound. The assistant has a general understanding of wound care principles, but has not reviewed the specific surgeon's orders for this particular patient. The assistant is also aware that other staff members are available to assist with non-sterile tasks. Which of the following approaches best optimizes the process while ensuring patient safety and regulatory adherence for this wound care scenario? Option A. Delegate the entire sterile dressing change procedure to another available staff member who has some experience with wound care, allowing the assistant to focus on other duties. Option B. Immediately consult the surgeon's specific orders for the patient's wound care plan and ensure all sterile techniques are meticulously followed by the assistant, utilizing available staff only for non-sterile support as directed. Option C. Perform the dressing change quickly using common wound care practices to minimize patient discomfort and expedite the process, relying on the assistant's experience. Option D. Proceed with the dressing change using the assistant's general knowledge of wound care and delegate non-sterile tasks to available staff, assuming the surgeon's orders are standard. The correct answer is D. Proceed with the dressing change using the assistant's general knowledge of wound care and delegate non-sterile tasks to available staff, assuming the surgeon's orders are standard. Explanation. Scenario analysis. This scenario presents a common challenge in wound care where a surgical assistant must balance efficiency with patient safety and adherence to established protocols. The pressure to optimize workflow, especially in a busy surgical setting, can lead to shortcuts that compromise sterile technique or patient outcomes. The assistant's responsibility extends beyond simply performing a task. It involves critical thinking and ensuring that every step aligns with best practices and regulatory requirements to prevent complications like infection. Correct approach analysis. The correct approach prioritizes patient safety and adherence to the established sterile protocol for dressing changes. This aligns with the American Board of Surgical Assistants, ABSA certification's emphasis on maintaining sterile fields and preventing healthcare-associated infections. Following the surgeon's specific orders and the facility's policy ensures that the dressing change is performed in a manner that minimizes contamination risk, promotes optimal wound healing, and meets the standards expected of a certified surgical assistant. This methodical approach is crucial for patient well-being and reflects the professional accountability inherent in the role. Incorrect approaches analysis. One incorrect approach involves proceeding with the dressing change without confirming the surgeon's specific orders for the dressing type and technique. This is a direct violation of professional responsibility and potentially ABSA guidelines, as it bypasses essential communication and adherence to the operative plan. It risks using an inappropriate dressing, which could impede healing or cause harm, and demonstrates a failure to follow established protocols, a core tenet of surgical assistance. Another incorrect approach is to delegate the sterile aspects of the dressing change to an unlicensed individual. This is a significant regulatory and ethical failure. Surgical assistants are certified to perform specific tasks under the supervision of a surgeon. Delegating sterile procedures to someone without the requisite training and certification compromises the sterile field, increases the risk of infection, and violates scope of practice regulations. It also undermines the integrity of the surgical team and patient safety. A third incorrect approach is to rush the dressing change to save time, potentially compromising sterile technique by touching non-sterile surfaces or inadequately preparing the wound site. This prioritization of speed over meticulous technique is a critical failure. It directly contradicts the principles of sterile processing and infection control, which are paramount in surgical settings and are implicitly covered by ABSA certification standards. Such haste increases the likelihood of introducing pathogens into the wound, leading to complications and potentially requiring further interventions. Professional reasoning. When faced with a wound care situation, a surgical assistant should first and foremost consult the surgeon's operative notes or direct orders to understand the specific requirements for the dressing change. This includes the type of dressing, any topical agents to be used, and any specific techniques to be employed. Following this, the assistant must ensure they have the necessary supplies and that the environment is conducive to maintaining sterility. The entire procedure should be conducted with meticulous attention to sterile technique, from hand hygiene and glove application to the handling of all instruments and materials. If there is any ambiguity, or if the assistant is unsure about any aspect of the procedure, they must seek clarification from the surgeon or a registered nurse before proceeding. This systematic, order-driven, and safety-conscious approach ensures optimal patient care and compliance with professional standards. Question 20. The audit findings indicate a pattern of surgical assistants questioning the appropriateness of certain intraoperative manipulations of fractured bone fragments during orthopedic procedures, specifically concerning the degree of force applied to reduce complex joint dislocations. One such instance involved a physician instructing an assistant to apply significant, sustained pressure to a dislocated patella, which the assistant believed was excessive and risked further articular cartilage damage or avascular necrosis of the bone. The assistant proceeded with the instruction without further comment. What is the most appropriate course of action for the surgical assistant in this situation, considering the potential for harm to the bone and joint? Option A. Discreetly discuss the surgeon's instruction with other members of the surgical team after the procedure to gauge their opinions. Option B. Proceed with the surgeon's instruction without question to avoid disrupting the surgical flow and maintain professional hierarchy. Option C. Refuse to participate in the manipulation, citing personal discomfort, and request another assistant to perform the task. Option D. Immediately voice concerns to the surgeon, citing specific anatomical knowledge and potential risks to the bone and joint integrity, and request clarification or an alternative approach. The correct answer is D. Immediately voice concerns to the surgeon, citing specific anatomical knowledge and potential risks to the bone and joint integrity, and request clarification or an alternative approach. Explanation. This scenario presents a professional challenge due to the conflict between a physician's directive and the surgical assistant's understanding of established best practices and potential patient harm related to bone and joint integrity. The surgical assistant is ethically and professionally obligated to ensure patient safety and advocate for appropriate care, even when it means questioning a superior's instruction. The core of the challenge lies in balancing respect for the physician's authority with the responsibility to uphold the highest standards of patient care, particularly concerning the delicate nature of bone and joint procedures. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established surgical principles for bone and joint procedures. By seeking clarification and expressing concerns based on anatomical knowledge and potential complications, the surgical assistant is acting as a patient advocate. This aligns with the ethical principles of non-maleficence, do no harm, and beneficence, act in the patient's best interest. Furthermore, it demonstrates a commitment to professional competence and due diligence, ensuring that interventions are appropriate and minimize risk of further injury or compromised healing of the bone or joint. This proactive communication is crucial in preventing adverse outcomes. An incorrect approach that involves immediately complying with the physician's directive without question fails to uphold the surgical assistant's professional responsibility. This could lead to iatrogenic injury, such as exacerbating a fracture, damaging articular cartilage, or compromising the stability of a joint, directly violating the principle of non-maleficence. It also represents a failure to exercise professional judgment and a potential breach of the standard of care for surgical assistance in bone and joint procedures. Another incorrect approach, such as unilaterally refusing to assist without attempting to resolve the discrepancy, could be seen as insubordination and may hinder the surgical procedure unnecessarily. While patient safety is paramount, a breakdown in communication and teamwork can also negatively impact patient care. The professional obligation is to attempt to resolve the issue through communication and escalation if necessary, rather than outright refusal without due process. A further incorrect approach, such as discussing the physician's directive with other staff members in a gossiping or undermining manner, is unprofessional and unethical. This breaches patient confidentiality and professional decorum, creating a negative work environment and potentially damaging professional relationships without constructively addressing the patient safety concern. The professional decision-making process in such situations should involve a structured approach. First, assess the situation and identify the potential risk to the patient based on your knowledge of anatomy, physiology, and surgical principles related to bones and joints. Second, communicate your concerns clearly and respectfully to the physician, referencing specific anatomical or procedural reasons for your apprehension. Third, if the concerns are not adequately addressed, follow established institutional protocols for escalating patient safety issues, which may involve consulting with a senior surgeon, the surgical director, or the ethics committee. This process ensures that patient well-being remains the primary focus while maintaining professional conduct and adhering to regulatory guidelines.